Starting today, the healthcare reform law will help women get more preventive care tests covered 100% under insurance. That means breast exams, prenatal care, scans for sexually transmitted diseases, and more. That's all covered by insurance. Now, this is a move that some doctors are praising, but others aren't so happy about it. Religious employers, for example, are exempt from providing birth control, which is the part of the law that so far has caused some of the most controversy. But preventive care is just one part of healthcare reform, a law that's really divided our country since it passed. We are joined tonight by our power panel, Melbourne pain physician Dr. Todd Jaffe. We interviewed him last night. He says healthcare reform could very well force him to shut down his practice. We also have in the house urologist Dr. Jack Cassell from Aldora, who made headlines of his own when he put a sign outside of his practice saying, "If you voted for Obama, seek care elsewhere." Finally, Susannah Randolph, a Democratic activist, here to talk about this very divisive issue. Thank you all for coming in. And Dr. Jaffe, we start with you. Really interesting. You say the numbers just don't add up for you in your practice since healthcare reform passed. But at the end of the day, isn't it just about providing good medical care to people who need it?
Well, I wish we could, but by 2020, Medicare is only going to be paying 1/2 of what they paid us in 2001, and that is not going to be enough to cover the costs of the practice. Our costs keep going up. We are not able to deliver the care without going out of business.
Yeah, Dr. Cassell, tell us what some of those costs are, because most people aren't doctors and don't know what it takes to run a practice.
Yeah, it's not a very efficient business. I mean, we've been cut about 5% a year for the last 12 years with the SGR, and we're kind of like break even. You don't see too many doctors with great cars anymore, and basically you cut us another 20 or 30%, and we're belly up.
Well, you know, Dr. Cassell, there are a lot of people, though, who say, and you, both of the doctors here, this question is open to you, don't mix medicine and politics. You both have made your opinions well known. What kind of reaction have you been getting since then? Dr. Jaffe, really quickly, then Dr. Cassell.
I have 100% in favor. I've only had 2 patients who have been upset by it.
Dr. Cassell?
Oh, come on, yeah. I mean, the politicians can tell us all about medicine, but we can't do it the other way around.
Well, yeah, and Susannah, let's bring you into the conversation. I mean, these are the guys, these are the boots on the ground, so to speak, the guys that are carrying out the care that all of us do need. What's your response when you hear that healthcare reform just isn't salient? It's not going to work.
Well, I mean, the bottom line is what everybody has to understand is that this is all the Affordable Care Act is a subsidy to allow people to buy private insurance on the market who can't otherwise afford it. Insurance companies are notorious for raising rates, making huge and posting huge giant profits. In fact, the day that the ACA was ruled constitutional by the Supreme Court, led by conservative Chief Justice John Roberts, the Columbia HCA stock went up. So, you know, these guys are making a lot of money, but the bottom line is that middle-class American families can no longer afford private insurance. This is going to help them seek that, which, by the way, is going to bring down costs because you're going to have a lot more people going to the doctors a lot more frequently.
To play devil's advocate,
with preventive care that will allow people to catch cancer earlier, and so they won't have to get into the most expensive treatment of things like
Dr.
cancer.
Cassell,
absolutely. Go ahead.
No,
absolutely.
You're dumping so many people into the system. I just can't imagine that anybody thinks that there's going to be more tests being performed and there's going to be more therapeutic modalities.
But there's no system that people are being dumped into. Yeah. This is a free market enterprise.
It's not free market. It's going to be
yes, it is. Absolutely. People are buying private insurance.
No
That's
way.
on the free market.
But more importantly,
absolutely it is. Read the bill.
Reimbursement for cancer chemotherapy is only going to be paid at 80%. People are not even going to be able to afford the chemotherapy that they need to treat the cancers. So it doesn't matter. People will die quicker. That's what the Democrats want. The only people who can get rid of this is Mitt Romney and giving the Senate back over to the Republicans.
All right, let me hop back in here, guys. And I want to know from the doctors, we only have 30 seconds left, so quickly, clearly the system needs to be reformed somehow. So if Plan A isn't working, what's the next version that is going to work? Because I think we ultimately agree here that people need good health care at a reasonable price.
I think we have to scrap the system and then reinstate those things that are good. The 26-year-old carry insurance, the insurance for those who have diseases so that they can keep getting insurance. Malpractice reform. Obama promised it, didn't do it.
Okay, guys, unfortunately we are out of time. It is a really interesting topic, and I think we have both sides really well represented here. Dr. Jaffe, Dr. Cassell, and Susannah Randolph, thank you for coming in.
Thank you.
Thank you.